Hello, my name is Christine Conti, and I am a chronic disease and fitness specialist. Today, I'm here to start debunking the myths around chronic conditions and exercise. Now, I know that many of us may have heard what you should or should not be doing, and we may have even read a lot of research with the pros and cons of exercise and many different studies that have been done out there. However, I am here to really shine the light on the facts of what should you be doing when you have a chronic condition when it comes to moving the body. And as a fitness professional, as someone who has studied chronic diseases for about 15 years, and also am someone who suffers from a chronic disease, this is for you. So I'd like to start by sharing my screen. We're going to do a little bit of kind of a lecture back and forth, and I want to show you some very functional, very turnkey exercises that you should be doing on a daily basis for chronic conditions. And it may actually surprise you. So let's go ahead and get started. Without any further ado, I'm going to share my screen. And once again, welcome to Debunking Exercise Myths Surrounding Chronic Conditions with yours truly, Christine Conti. Now, I want to know, are you one of the over 125 million Americans living with a chronic disease? Now, that number is growing, and it's growing every single day. And when we talk about chronic conditions and chronic diseases, it's normally not just one. Someone that is suffering with obesity. They may also have high blood pressure, diabetes, forms of arthritis, and the list goes on. So when we think about chronic disease, many of that, or most of that 125 million, it may just not be one. And this is where we really need to start thinking about what can we do to keep that number from going in that wrong direction and rising? How can we best help and best serve this population? And in the fitness industry, we've been talking now and have been making some progress about realizing that fitness is not sexy. Fitness is not just about how do I look in those pants, or getting that six-pack abdominal look. It's about how can I live more quality years? How can I get up and not feel pain? How can I function and go through my life and feel good? And that is what this is about today. It's about helping that population that is the largest in the United States, especially the people that are highly fit and the people that are going to really push it in the fitness world and in the gym. That's not who we're talking about. We're talking about the other 80% of the population that doesn't do anything. And those are the ones that normally are suffering from chronic conditions. So what we're going to do today, just to lay this out for all of you, is we're going to identify and debunk some of those myths surrounding chronic conditions and exercise. And you're going to experience safe and effective exercise. It's just very simple to improve joint mobility, flexibility, improve range of motion while promoting greater independence. And that is a word we need to keep in our daily vocabulary. Is what I am doing helping myself or my client live more independently and for more years. And also to gain a better understanding of how to communicate with clients who have chronic conditions to improve trust. Because if we don't have trust from our clients, they're not going to do what we tell them. And if we're educated about chronic conditions and movement, then we're the ones who have to go out there and go against the grain sometimes and fight the current of, I should just rest. Well, what happens when we don't move our joints, when we don't move our muscles? It's worse. And these are the things that we're going to talk about with what's the difference between a chronic condition and feeling chronic pain versus, and I'm going to say it, exercise pain. Exercise pain should not be something that's debilitating, but exercise is not always comfortable. So that is something we need to be aware of as well and have that conversation with your clients. Listen, it may not always be rainbows and butterflies, but we have to keep moving. And movement's important, and sometimes movement is difficult. So what is chronic pain? Well, this is what we're talking about when people have chronic conditions. They have chronic pain, and it's defined as any pain or symptoms lasting over an extended period of time. Now, let's say you twist your ankle because you stepped wrong. All right, it may last a few days, a week, goes away because it's due to an injury. Well, chronic pain is not something that goes away. You can feel it for weeks, months, years, and various body parts. What I do want to mention about chronic conditions that I'll tell you later is think about mental chronic conditions as well. Think about if someone has depression. You can be sad because of an event or something for a couple days, week. But when that starts lasting months, years, you never feel good. You never feel happy. The same idea. So just always keep that in mind when we talk about chronic conditions. It's not just physical conditions we're dealing with, but that chronic condition, if someone is in constant pain due to spinal stenosis, something going on with the back, that may lead to feelings of depression. And now we're talking about multiple chronic conditions. And what I like to say, the word is comorbidities. So not just one, it compounds. So just something else to be aware of. But this is long lasting. So when you work with a client, ask them, how long has this been going on? Just to get an idea of how long they've been dealing with it. Now, what is a chronic illness? As I said before, all types of illnesses and conditions. So arthritis. When we think about arthritis, sometimes a chronic condition could be osteoarthritis. Most common form. As we get older, our body suffers from overuse, the wear and tear, right? Have you been working in a job where you're very active, you're lifting? Again, construction, building, carpentry, it's very demanding on the body. And over time, what happens? Wear and tear of the joints. That synovial fluid in your joints, instead of being nice and loose and lubricating, starts to get really tough. And what happens is it affects the way your joints move. They don't move smoothly. So that is your osteoarthritis. It could be because of a former injury. Maybe you got hurt. Maybe you were a high school athlete or college athlete. Maybe you just had a broken bone. That could happen. Buildup of calcium, you get bursitis. All right, we're getting arthritis in those joints, bone spurs. But what happens, arthritis can be autoimmune diseases as well. It could be rheumatoid arthritis. It could be psoriatic arthritis, lupus. And when we think about autoimmune diseases, they don't just affect the joint. Just like osteoarthritis, if you have a bad shoulder, all right, one bad shoulder. If you have a bad knee, it's that one bad knee. But with rheumatoid arthritis, it would not just be your right shoulder, your left. So everything is symmetrical in your body. So again, You would have swelling, pain, redness, soreness. With psoriatic arthritis, you'll have a rash. And also with many of these, you have issues with your internal organs. So an autoimmune disease doesn't just affect your joints, but also your internal organs, such as your heart. Because if we're talking about circulation and we're talking about blood flow, we're talking about also your lungs, also your intestines. So you've issues digesting food, issues with breathing. Sometimes people think they have adult onset asthma. So very important to keep this in mind when you're working with your clients. Now, obviously, chronic illnesses, cancer, all forms, shingles, Parkinson's, Alzheimer's, fibromyalgia, neuropathy. Again, for those of you unfamiliar with various forms of neuropathy, that affects the nerves. And neuropathy can be very painful, like your foot is just being, pins and needles it's almost like you're walking on fire glass. Those nerves are just overactive. Neuropathy can also appear in your head, extremely painful. And when those nerves are agitated, it could be to a point of, the worst migraine you could ever think of. Many people go to the hospital for that. In addition, all forms of eating disorders, sometimes we don't think about that as a chronic condition or illness. In addition, we may not think of alcoholism, another chronic illness. And obviously your MS, ALS, neuromuscular disorders as well. Bell palsy, stroke, and on. So I just wanted to bring to your awareness the most common that you may come across. In addition, when we talk about, I'll go back to eating disorders, obesity is, can be a part of that as well, diabetes. And again, on and on, important to know what they are is number one. And don't expect that you have to be a, specialist on every single chronic condition, but you need to be aware of kind of the umbrella of what we should be doing, what we should be asking, what types of doctor approval or doctor's notes we should be asking for as fitness professionals, because then we are the ones who are going to use our exercise science knowledge to best help those clients when we assess their body. Now, symptoms of chronic pain, symptoms of chronic pain syndrome. So anything where you're, again, weeks, months, years, it's going to take its toll on your physical and mental health. Sometimes pain, certain clients, it could be nearly constant. And sometimes with various forms of arthritis, maybe a flare-up, where you may be, feel like something is throbbing or a sharp shooting pain. Sometimes maybe it's due to stress. Again, the hormones, the chemicals that are released in your body, stress is a huge factor that affects chronic pain. So people with chronic conditions, so important to do that breathing daily, to assess their own body. Are they holding on to stress in their neck, in their shoulders, in their hips? We're going to go over that in a minute of what we can do. So simple, yet so often overlooked for this type of population. Now, joint pain, muscle aches, burning pain, fatigue, and more is what we're thinking of. And again, chronic could be, does it come and go throughout the day? Or is this something that is constant? Or is it here 1 minute, gone the next? Sometimes people think of them as ghost pains. Where did this come from? I didn't do anything to my ankle, yet it feels like it's sprained or broken. That is something we need to be aware of as fitness professionals, because what your client did one day with a chronic condition, they may not be able to do the next day. And when we talk about debunking myths, guess what? Not doing anything is not okay. So maybe they came to you on Monday and they were awesome. And on Wednesday, they say, oh my gosh, I feel awful. I feel like I can't do anything. Well, it's your job to say, I want you to come. I want you to be here, but we are going to move in a different way. Maybe we're not going to be picking up weights. Maybe you're not going to be walking on that treadmill. but maybe you're going to be doing some range of motion work, some breath work, some meditation. That is exercise. So all these rest days, yes, people should have elongated rest between exercises, but they still need to be moving. So the whole idea of, oh, you don't have to do anything today, throw it out the window. We need to re-evaluate what we're telling people. So let's keep going. What I want to stop for a second before we go on to anything else is the psychological symptoms of chronic pain and chronic conditions. So studies, clear studies. Now, I picked arthritis because that is what I have spent a lot of time studying. And I wanted to pick one just to throw this out here because there is a statistic that 1 in 4 people, adults, 18 and older in the United States, have one or more forms of arthritis. Now, if I were to ask you right now, if you're watching this, think about 4 people in your life, including yourself. Does anyone have arthritis? And sometimes it's more. Sometimes it can be all 4 because it's so many different types. Now, people with arthritis that have very high pain due to it are most likely to be anxious and depressed. Now, what's interesting is that I want you to think about this scenario for a moment. Think about this scenario. You go to your favorite vacation spot in the whole world. You've been looking forward to it your whole life. You go on vacation, and the entire time you're on vacation, you have a terrible toothache. And if you've never had a terrible toothache, I want you to imagine you have a terrible headache, really bad headache the entire time. What are you thinking about on that vacation? Are you thinking about how wonderful this is and the scenery and the people you're with? No, you're thinking about, oh my gosh, I'm in so much pain. I can't enjoy this. I wish it would go away. And guess what? That is what it's like every single day for someone living with chronic pain. They can't do things because they're limited and they're in pain. And what happens is that the pain incites depression. You're not enjoying life. And it is physically and emotionally stressful. So what does that do? From a science standpoint, it actually changes brain and nervous system chemicals. Now, these are your stress hormones, neurochemicals, your cortisol, serotonin, norepinephrine, dopamine. These are all things, I know you've heard them before, affect your mood, thinking, and behavior. So now your body is off balance. And guess what? This brings on depression. So not only are you dealing with clients who have chronic pain, and we've got to work around that, we also need to work around being positive. And if they're going through depression, anxiety, frustration, anger, grief, all of these, it's almost like the stages of grief people go through. It's important just to stop for a moment and realize the importance of a mental check-in. And as I said, debunking myths around exercise is that, listen, exercise doesn't have to be picking things up and putting things down. Exercise can be mental exercise, guided meditation, and really thinking about what does exercise mean? So it may be very different than what you've always been taught. And for this demographic, it could make all the difference in the world. So it's time to get right into this now that we've kind of laid out the groundwork. And here are some of the exercise myths. Okay, who has heard exercise causes increased inflammation and pain? Exercise causes a risk to the heart and lungs. Lifting weights is detrimental, and high impact activity should be avoided. And you know what? Exercise should be limited in frequency, duration, and intensity. Who has heard these? I've heard these so many times in my life from people that probably need to exercise the most. Well, you know what? I have arthritis and I'm overweight. You know what? If I exercise, it's going to cause more pain. Okay. Now, if you have arthritis and you are extremely overweight. You're categorized in the obese category. How much impact, how much pressure are you carrying around on your joints, on your ankles, on your knees, on your hips? In addition, what happens around your internal organs when you are 50 pounds, 75 pounds overweight? Around your internal organs, fat is stored. Guess what is less likely to function efficiently? Your organs, your heart, your lungs. This is really powerful stuff. So when we think about movement and strength, if you don't do anything, it's only going to get worse. And this is where we need to really assess and say, listen, I don't need you to do something crazy, but I need you to move. I need you to get those joints going. And the heart and lungs as well. I mean, what's the most important muscle in the body? It's your heart. It's not the biggest because your skin is your biggest organ in your body, right? So protect that too. But the heart. So the heart and lungs, they need that oxygen. They need to work. And lifting weights. Listen, you don't have to lift heavy weights, but I want to ask you to look around your house. Look around what you do every day. Do you lift anything? I mean, most likely you may have lifted a toothbrush. Maybe you lifted a can. Maybe you lifted a pot, a gallon of milk. What did you lift? Because that is exercise. But we want to make sure that you're strong enough to actually function on an independent basis in your life. High impact as well, just to get back to that for a moment. No one should really be doing anything super high impact. But I want to ask you a question. High impact activities should be avoided. Now, if people have chronic conditions and they are a runner and they have good form, and maybe high impact could be jumping rope. If that doesn't cause them a flare up or increased pain, and they enjoy doing it, it brings them joy, guess what? You can't tell someone no. It's very individual. And that's what you're going to see with people with, I see runners, I see cyclists, I see swimmers. Some of these activities, more impact than others. But again, saying no and putting a huge category, throwing it out the window is not okay. If you do work with someone who is feeling good, there's nothing wrong with saying, all right, you're running. I want you to just assess. We take it at slow intervals going forward. But again, frequency, duration, and intensity should all be an individual assessment. There's not one person that is going to be exactly the same. And I want you to think of a snowflake. First of all, Parkinson's disease is considered the snowflake disease because not one person has the same exact symptoms. So could any other disease. Maybe there's similar symptoms, but not exactly the same because every body is different. And I'll leave it at that. So let's start here. So there seems to be a great deal of misinformation circulating about effective exercises to fight symptoms and progression of various chronic conditions. Let's talk about myth one. Chronic condition, you should not be lifting weights, running, or jumping. Further damage to joints and brings on severe flare-ups. False, and false. Lifting weights. You don't have to be an Olympic lifter to lift weights, but lifting weights gets you stronger. It actually helps support those joints that may be damaged or, having a little flare up. Lifting weights is fantastic for your heart, for your muscles, reduces falls, helps independence. And again, running or jumping, if that works for your body, then that is something that you can encourage, but only after a formal assessment. The second, running causes severe pain, then maybe you should reassess. but it's not for the trainer to say no. And also for a doctor. Doctors have maybe not gone into, in-depth exercise science courses and degrees and fitness courses. So there's something to be said for please always assess and ask questions. Myth 2, incorporating weights or single leg weight bearing exercises can be dangerous with weak muscles and balance issues and poor flexibility. Well, it is even more dangerous if you don't do any of this. How about that? So when you walk, that's single leg weight bearing exercise. One foot's up and one foot's down. There you go. And what we also want to think of is how often do you pick up a foot? Do you ever have to pick up your foot and step over something? What about stepping up stairs, a threshold, a bathroom? So what the problem is here is that if you don't practice, it's going to get worse. Your muscles will atrophy. And falling is huge. Throwing it out there. People that fall, I don't care what age, people that fall, that break their hip, there is a over 25% rate that they pass away within 6 months of their hip fracture. Think about that for a moment. So maybe they have, some issues going on, some weak muscles, balance issues, flexibility problems. They don't really do anything. Now they fall, they break their hip. What happens to their muscles? Do they get stronger? Now they're inactive, it gets weaker. Their whole body gets weaker. Now their mind is, you're not moving as much. You're in more pain. It's compounding. And what winds up happening is that people are really declining much more quickly after something like that happens, which is why, again, we've got to think about, hey, if someone says, oh, your leg kind of hurts, I'm going to rest it. The worst thing to do is not move your body. The worst. If you're not going to move it, you're going to lose it. So you don't have to be standing. Exercise reimagined could be seated exercises. You can be marching in your chair, but we've got to be doing something. And it starts here and it starts with you. So here's your fact. Write this down, shout it from mountaintops. Safe and effective weightlifting, cardiovascular exercise supervised by a qualified chronic disease specialist, arthritis specialist, medical fitness specialist, and professional is very effective. Relieve, reduce chronic pain, and guess what? Lifestyle changes can positively impact individuals with chronic conditions, and it impacts their mind. What happens when your body moves? Your heart rate goes up. You're taking in more oxygen. Your blood is oxygenated. Your muscles are like, please, please give me more oxygenated blood because it feels good. It builds muscle. And you know what? That is when we release those endorphins. Why do you feel better after moving? Because the body's like, oh, thank you. This is awesome. I'm releasing all these chemicals. It's a natural high. It feels good. So once you start moving, after you're done, your body thanks you. And that is something we need to be aware of. So yes, we should assess, we should be mindful, we should get, some doctor feedback if someone has a chronic condition before you even start working with them. But talk to your client. Listen, here are the facts. We could pull out research studies from all over the place. These are the facts. And as we start debunking these myths, listen, here's what should be happening. Someone with chronic conditions, in fact, anyone should be lifting weights. Now, maybe they're light weights, maybe they're cans, maybe they're water bottles, but repetitive movement helps build muscle. Cardiovascular exercise helps your heart, helps with heart disease. So these are things that we need to keep doing. So when you ask yourself, all right, you know what? This person is having issues with their feet. Maybe we can sit them in a chair and still get their heart rate up. That's what we need to ask ourselves. Are we doing what we can right now regarding exercise to best serve this growing population? So myth one, let's take it from here. Activity worsens joint pain and inflammation. Okay. As with any form of exercise, overdoing it can worsen joint pain and inflammation. There you go. We're not pushing these people with chronic diseases, go harder, lift more, one more, embrace the pain, no gain. No, nope. This is functional movements. So again, working the joints. Again, one of the best complementary natural treatments is one they can do themselves, and that is exercise. And when we think about exercise is simply moving the body. Laps around your house is exercise. Folding laundry, bending and twisting and moving is a form of exercise. Sweeping the floor. So again, a natural treatment. Myth two, you shouldn't exercise if you have a chronic condition. I picked arthritis. As I said, I picked one. Now, if you have any sort of autoimmune disease, right? Again, maybe not just a typical wear and tear chronic condition. It goes beyond the muscles, bones, and joints, and now organ involvement, like we said before. Your heart, your lungs, your eyes, we didn't recognize that, ears. And guess what? Twice as likely to develop heart disease compared to the general population. That is a big statistic right there, especially since heart disease is the number one cause of death for women. There, I said it. We think it might be cancer, right? It's not, it's heart disease. Now, the heart needs to be exercised, especially for people with any chronic conditions. So if we're not moving, your heart is like, oh, well, I guess I can, become less strong as well. And not pushing that blood around your body and circulating, that is a problem. Exercise, also your lymphatic system. Okay, I'm sure we've all heard of lymph nodes. Okay, well, so lymphatic system encourages muscle contractions, pumping fluid all over your body. So this is what it is, in case we didn't know, the system network of tissues and organs. Their job is to help the body get rid of toxins, waste, and unwanted materials, fights viruses, bacteria, disease. It strengthens the immune system. Who has heard about lymph nodes? Probably all of us. Sometimes people think, oh, I've swollen lymph nodes because I'm sick, right? On your neck, you'll feel them. Let me check your tonsils. Well, maybe people have lymph nodes underneath their arms. Sometimes they get inflamed, and there is lymph all over our body. And people who have cancer, sometimes their lymph nodes, you hear it goes into their lymph nodes. This is important. Exercise helps flush all of that bad stuff out of the lymph nodes. So that's your lymphatic system is really important. So again, not exercising, that actually hurts your chronic condition because your body is not using that lymphatic system, is not working correctly. It's not being efficient. So there's another extremely important myth to debunk. Now, myth 3, please don't laugh. Let me explain myself. Pain is a bad sign. Well, yes and no. So yes, with a chronic condition, you can experience pain off and on. And when working out, we have to think about, is this pain from exercise or is this a chronic condition? It's tricky because normally when we're moving or lifting weights or squatting, the body will say, oh, this is pain, don't do it. Well, there's a difference. When you exercise, you may feel a little, I call it warm and fuzzy. Some people call it fiery. Your muscles are fired up. Is it a burning kind of feeling? Is it really warm and hot? discomfort around your muscles is a good type of pain. It's your muscles telling you they are being worked. We're working. And guess what? Sometimes you'll work muscles that you haven't in a while and you'll be like, oh my gosh, I call it your muscles are talking to you. They're talking to you, they're telling you they're there, and we need to be worked. Because the more you work your muscles, the less they are going to be screaming at you. And there's a difference. Again, maybe you're sore for a couple days, totally normal, certain muscle group. But if you have excruciating pain, like a stabbing pain, acute pain, that is when it's, you know what? This isn't a good sign. We need to slow down. We need to pull back. But not feeling any discomfort is not necessarily true. We should get out of our comfort zones a little bit. It's the same thing in life. How are you living? Are you living outside of your comfort zone? Are you taking chances? Are you overcoming fears? The same idea with your body, but calculated risks, right? Your exercise should be, if you're supervising someone, you are the one calculating the risk of the frequency, duration, time that they're doing it. And again, you're the one that's also calculating, asking them questions, giving them constant feedback. What's the difference in your pain level? Are you feeling something today? Is this just soreness? And again, if there is a certain pain, if someone comes in and says, my right arm is really painful and sore today, guess what? Maybe it's time to really focus on the hips, the knees, the ankles, toes, feet. Maybe that's the focus of the day. So yes, pain shouldn't have acute pain, but pain, a little burning discomfort is okay. Now, 4, exercise causes joint damage. Oh my gosh. Okay. So the opposite is true. Not exercising increases chance of joint damage. There, I said it. You hear I'm getting all fired up right now. Movement is natural. We're supposed to move. We're not supposed to sit and be sedentary people. Go back to the cavemen. Okay, our original humans on this planet, as far as we know. Okay, I'm not going into religion here, but evolution, human evolution. What did they do? Constantly moving. If they weren't moving or running, they were getting eaten by a bear. Okay, it was always movement. They had to get food and water, and they were nomadic. They didn't set up a city and put in an air conditioner and sit behind a desk all day. That wasn't it. Look at our spines. When I analyze someone, I look at, I look at how they stand up. I look at their posture. There's so many problems that we have from bending over, our kyphosis of the spine. So when we think about this, being sedentary for a period of time, okay, surgery, recovery, severe flares. I get it. There's certain times we need to recover. Recovering is not the same thing as, I'm just going to rest for 5 days. I'll exercise one day. No, as soon as you feel, hey, you know what? Let's do this. Moving the body helps lubricate the creaky, squeaky joints, strengthens muscles, and increases flexibility. Guess what? When your muscles are stronger, they're going to help support your joints better. And hence, domino effect protects them from being damaged. So again, if you step in a uneven flooring and your knee moves, well, if you have strong stabilizing muscles, your quadriceps, hamstrings, your calf muscles are strong and they're used to moving, it is better going to support you as opposed to your knee going out. And that is what's extremely important. Now, extreme exercise can cause joint damage. Absolutely. You've been running 20 miles a day since you were 4 years old. Absolutely. You're going to have some osteoarthritis. It is normal wear and tear, but simply just moving and exercising with, kind of under the careful watch of someone who is a professional, that should not cause you joint damage, but actually alleviate joint pain and improve your joint stability, flexibility, and strength. Last myth right now. people with chronic conditions can only do certain types of exercise. No. Now, if you have gone to a doctor, if you have a chronic condition and the doctor said, you know what? Now that you've got cancer, lupus, arthritis, Parkinson's, Alzheimer's, you know what? No more running. Well, why? Tell me the why behind it. Is there something that is seriously dangerous? Did something happen? Or is everyone just a little bit different? And that is where this comes into play. Disease, activity, surgeries, severity of the condition. What is it when we're creating an exercise routine? Because some people with chronic conditions, exercise helps them physically, mentally. Exercise reduces symptoms of chronic conditions. I said it. It has been proven to slow down the development, the severity of Parkinson's. Why do you think there's rock steady boxing? Why are we constantly working on brain-body health? Lighting up the synapses, firing from our brain to our muscles. We talk about brain exercise. Some people call it neurobics, right? So what are we doing? Neurobics, some sort of neurological stimulation. I love to add rhythm, add some sort of maybe a guessing game, going through the alphabet. We're going on a picnic, starting with A, B, C, D. And I call it exercising the hippocampus, your working memory, because some chronic conditions affect your brain. So who says that during doing only certain types of exercise are what you should be doing? Well, it depends on the person. And low impact tends to be the norm, which is great. Maybe you're in the pool, you're doing your walking in a pool where it takes all of that weight off of your joints. It's fantastic. Little natural resistance from the water. But something like running or a higher impact can be extremely beneficial for people if it's done safely. And once again, supervision by a medical fitness professional. So I beg of you, as you think about these myths, what is it that you may need to rethink when you're dealing with a chronic condition with your client? Are you having them do too much? Or are you maybe not exposing them to certain exercises that they may really enjoy and may be very beneficial and maybe a key to reducing some of their pain? And that's your job. So when we talk about debunking myths, well, exercise is crucial. Strength, flexibility, reduce joint pain, combat fatigue is another one. And sometimes it does seem overwhelming for your client. And, you may say, all right, today we're going to be doing legs. And they're like, oh, my legs are so sore and achy. Well, even something moderate is important. Sitting in a chair and, sitting in a pool and moving the legs, that is more important than doing nothing. And that's what I want to drive home today is something is better than nothing. So when chronic conditions threatens to immobilize your client, exercise will keep them moving. And if you're not convinced yet, lifestyle, yes, can positively impact chronic conditions. So daily range of motion exercises. What are we going to do with it? Relieve stiffness, increase the ability to move your joints through the full range of motion. This is where we start. And they may be simply raising your arms overhead, rolling your shoulders forward, backwards, and they can be done daily, multiple times per day. And you can give your clients a video. You can give them a sheet written down with what it is. And if they're not with you, that should be their homework. And if you're wondering what this looks like, we are going to do this together. And this honestly takes about 5 minutes. but I want to show you what range of motion exercise looks like for someone with chronic conditions. Now, we start with some deep breaths because it's all about relaxing the mind, getting yourself in the right frame of mind. If someone comes in with a chronic condition, they're in a bad mindset, they're in a lot of pain. What do we need to do? Flip that mindset so that we can get that trust, so that they can then maybe do some things they did not think they can do, which would be highly beneficial for their bodies. And maybe, just maybe, this is the only thing they can do, but it still matters. So we're going to go through and loosen up those joints for a moment. And I'm going to go ahead, I'm going to stop my share and bring myself back. And now you don't need to be in a workout outfit to be doing this. So I'm just going to step back right now. My feet are about shoulder width apart, whether you want to be seated or standing. And let's do it. So if you feel comfortable, you can close your eyes or leave them open, but we're going to take a nice deep breath in the nose, exhale nice and slow out the mouth. So inhale, exhale. Do that again, inhale, exhale. One more time, inhale, exhale. Oh, good. Start to relax, start to roll the head, just slowly side to side. Good. You're going to start to release any tension, any stress you're hanging on to. Good. Really relaxing that trapezius muscle. We're just moving that cervical spine. And now let's take it to one ear to one shoulder. Get a nice stretch. Feel a lot of room between that ear and the shoulder. And now slowly to the other side. Ear to shoulder. Big stretch. And now side to side. Just be aware of the neck. Good. Bring that right to center. Take a deep breath in. And exhale, relax. Start to roll the shoulders back. So we're going to come up to the ears, back and down. Good. So now that we've gotten through that neck, let's see how those shoulders are feeling. Good. Really moving. I'd like to say if you feel any, or if you hear any clicks, pops, cracks, I call it the Rice Krispies. Good. Let's reverse. Normal to hear that body talking to you. What's not normal is stabbing or acute pain, which is when you should go to a medical professional, let them know. Good. Big rotation. Good. Let's release the shoulders down and once again, bring one ear to one shoulder and slowly roll it to the other side. Good. Bring it back to center. Take a deep breath. Bring the shoulders up to the ears. Inhale and exhale. Good. Inhale and exhale. Excellent. Go ahead and put your hands right on your hips right now. And I want you to just roll those hips around. All right, like a big hula hoop is what you're doing right now. Big hula hoop. Good. And now I want you to roll the other direction all the way around. Again, clicks, cracks, pops. As long as you are not in pain, maybe your leg didn't fall off, okay? Totally normal. We've got to get through those hips. Good. And I want you to lean forward and backwards now. Forward and back. I'm going to turn to the side. My back is nice and flat. I'm just going forward and back. That's it. So when we bend forward, you're going to feel the lower back, the hips, the hamstrings, glutes stretch out. And then when we go forward, as you press the hips forward, feel the hip flexors stretch out. That's it. And hold it right here. Good. Stay right there. Put your hands right on your thighs. All right. I'll bring this down just a little bit. So my hands are right on my thighs and I'm going to press my hips back and then I'm going to bring the hips up. So the hands slide down to the knees and slide all the way up. If you're in a seated position, we're doing the same thing on the chair. Forward and then bring it right up. Good. Bring it forward and bring it up. A couple more. Bring it on forward and up. One last time. Bring it forward. Good. So just bending through the hips and the knees. Excellent. And then all I want you to do is pick up one leg. So we're just marching. We're marching, right? Feeling it through the hip flexor, bending the knee. Good. Very basic, very functional movements. So what are we doing right now? Single leg weight bearing exercise. I'm putting my weight on one foot and then the other, just testing out that balance. Good. I am working through the elbow joint as well as I do this. And now what we're going to add is a little grip strength, right? Right through the hands. I want you to make a fist. Everything is tight in the arm as we do it. Good. Just a couple more. Right through those fingers. Remember, those joints in the hands, a lot of chronic conditions affect those hands as well. Good. Stay right here. And I want you to just roll one ankle. I'm just standing on one leg. I can always hold on to the wall if I need to. And then bring it to the other side. Roll the ankle all the way around. Good. Just put that down. I want you to put your hands up just like this. I want you to open your fingers and open your toes super wide. Open them. Take a deep breath. Exhale. Bring your toes and bring your hands. You can grip. So your feet, your toes are curling under, nice and tight. You're going to feel all the muscles in your feet and your ankles, your calves, your shins light up, and then open everything. Your toes are wide. Your fingers are wide, and then shake that off. Good. You're going to give me a nice big deep breath, but this time bring your arms up if you can. Inhale up. Exhale. One more time. Inhale up. Exhale. Good. And now I want you to give a big bear hug round the upper back. There's lots of room between the shoulder blades. Good. And now just open them up like a nice little cactus or a field goal. We're going to do that again. Inhale, round. Good. Get right through that spine, that thoracic spine. Good. Again. Good. And round it. Hold it right here. Stretching from all the way from the top of your head all the way down through that tailbone. And bring it right here. Bring the hands by the hips again. And a nice little rotation all the way around. Good. And then the other direction. Perfect. And stay right here. Take a deep breath in. Inhale up. Exhale. And that is joint mobility from head to toe. All we did was take a moment or 5 minutes, clear the mind, use the breath, oxygenate that blood. And we went through every joint in that body, every major joint from our cervical spine, down the spine, our shoulders, our hips, our knees, our ankles. We worked the toes, the hands, wrists, elbows. And that is something that we sometimes get ahead of ourselves when we're working with people with chronic conditions. That is something I actually do with clients when I'm doing an assessment. And I will say, this is how we're starting. And I ask them, how does your neck feel? Is anything in pain? Are you holding on to stress in your neck, your hips? What is it? And it's a great way to start with someone each day, not just once a week, not once a month, but each day, so that they can really understand and connect with their body and they can express to you what's going on. A great way to build trust, and also very simple yet important way to understand what is going on with that client with a chronic disease. So I'm going to take it back to the screen right now. And this is exactly what we did. So from head to toe, range of motion exercise. So with that said, I want to know, are you smart when it comes to chronic conditions? And what that means, I love the SMART: specific, measurable, attainable, relevant, and time-based. Are you doing this when you're designing a program or working with someone? I do want to mention that people with chronic conditions, I normally limit, depending on their, just depending on what their activity level is, the progression of their disease, if that's what they have, if they have a disease, to 30 minutes. Again, higher functioning, people with chronic conditions, the sky's the limit. But I want to make sure that you are always coming back to the specific, measurable, attainable, relevant, and time-based idea. Now, I do have to tell you something about this. Each work, yes, is a building block for your why. But I want to tell you that this is not based on scientific theory. So this talk right now is about debunking some myths. So while this is important to do, I also want to tell you that it omits the focus on people's why for being active. So the SMART is very much about you, the fitness professional, not as much about the client, which is where you come in. So really important to keep an eye on the why of your client. Why are they here? So if I'm doing a specific exercise and we're working the biceps, we're doing some sort of bicep curl, maybe, they have something going on with their wrist due to arthritis, and you're using a band or a wrist weight. Well, tell them, hey, we're doing this because I want you to be able to cook that great holiday meal and lift all those pots and serve your turkey or what. Okay, what is it that motivates them? Is it the fact that they want to get on a kayak? And, is it the fact that they want to get into a pool? Is it the fact that they want to attend, an event? Do they want to pick up their grandkid? Do they simply want to not feel pain throughout the day? What is their why? Because that is going to help you develop these SMART goals. It can't just be you saying, here's what we're going to do. Here's how I'm going to measure. No, it's why. Asking them why, and then telling them every single time you do something, how does this resonate with them? Why are we doing this? And get them hooked onto the why. And that is going to help with motivation and trust. So some other things we want to talk about before we end today is aerobic exercise, cardio health. Okay, what is this going to do? And I want to talk about helping control weight, stamina, energy. So some examples of this: easier on your joints, walking, biking, swimming, elliptical. Moderate aerobic exercise should be done every week. People with chronic conditions, the heart rate needs to be up. And again, if it's too much to walk for 30 minutes, break it up into 3 10-minute walks. Could be around your house. And again, moderate intensity for aerobic exercise, safe and effective, done most days of the week. Oh, I said it. We should be doing something almost every day. Yep. Gone are the days of, Monday, Wednesday, Friday are my exercise days. And then maybe Saturday, Sunday. No. We need to be doing something every single day. We don't have to be doing something crazy, but we have to be moving. A rest day can simply be something where maybe our rest day, we did some gentle yoga. We went through the exercise progression I just took you through. Maybe it's breathing exercises. Maybe it's meditation. It has to be something. And again, when you're exercising with anyone, see if you can carry on a conversation. We shouldn't be totally out of breath. What's the purpose of, unless you're an elite athlete, being completely breathless does not have a purpose. It does not serve a purpose of quality of life or cutting down on acute or chronic pain. And the other thing is, heart rate monitors are great. If you're not sure, have a client wear a heart rate monitor. Maybe it's on a watch. Maybe you give them your watch. I've done that before during working with someone. Here, you don't have one? Put on mine. Let's see what your heart rate is as we go. So again, really great ideas. Strengthening exercises as well, debunking that myth that yes, it helps build strong muscles to support and protect your joints. There it is. Maybe you're not going to be doing legs or squatting every single day. Fine. Rest days are fine when you're strength training. Right? I said we should be moving every day, but you should not be lifting heavy every day or working the same muscle groups. People who have chronic conditions, you may need 3, 4, maybe even 5 days to rest that muscle group sometimes after really working it. So frequency does matter. Maybe a 3-day-a-week program, but 2 days is all you need. 2 days. Research, 2 days of some extra strength training will maintain your muscles. Think about that. We're not asking for, a million, days every hour, but 2 days should be some sort of strength. And that is important. So a little more facts before we end. 1 in 4 adults in the US has a chronic condition like arthritis. 1 in 4, by the way, reports joint pain. 1 in 10 in the US limits activities because of 1 or more chronic conditions. And then over $300 billion in the US are spent each year on medical spending and lost wages. Even more facts. Mayo Clinic, those with chronic conditions need to exercise. Oh my gosh, here it is. I'm laying it out right now. Strengthen muscles around joints, increase bone strength, improve energy, sleep, control your weight, increase balance, enhance quality of life, and independence. Independence, you can't move, you can't live independently. And that is something that is really important to anyone with a chronic condition. Are you going to be dependent on your family, your friends, high medical bills, things like that? Taking care of ourselves and exercising is something we can do and we can control. Maybe we can't control our chronic condition. Maybe we can help it, but we can control what we do. And lifting weights will ease joint pain, bone strength, metabolism, core strength, flexibility, mimic everyday activities. How often do you pick something up? So again, we're not talking about lifting hundreds of pounds over your head unless you throw tree stumps as your job. It's very basic of, can I pick up a bag? Can I pick up the garbage? Can I twist when I'm doing laundry or emptying a dishwasher? That is what we're going for. And reimagining our exercise with chronic conditions is what we need to do. So the next time someone says, I can't do that, I have a chronic condition. Well, yes, they can. And yes, they should. And those are the people that we are out to convince. Because right here, this picture you see, that's not what we're looking for. We're not lifting these weights and grunting. It's a functional exercise to promote longevity and independence. And again, opening a soup can, unlocking a car door, pots on the stove, sit to stand positions, that's like using the bathroom. It helps with joint stability and also helps with your risk for falls by strengthening those stabilizing muscles. So a couple things I want to mention real fast. Resistant bands are really great. Again, resistance, you can actually control the resistance. So people with chronic conditions, takes pressure off wrists, hands, fingers. Weight machines add extra stability, and use light weights, slow and controlled. They will help greater range of motion and flexibility as well, so that you can build up if, and when you want to increase the weights. But other things we can ask or we can add on to this, maybe tell a client using heat to relax the joints if they're very stiff. Slowly and gradually adding movements. Assess, reassess, assess again. Start really small, those soup cans, those water bottles, helping with that elbow joint, performing the bicep curls, slow and basic. And joints are going to be uncomfortable. Your body may be uncomfortable, and that's okay. It should not be painful. And at the end, if someone does feel, hey, I'm extra sore today, or try ice, right? Ice, what does it do? It reduces swelling, okay? Reduces that blood flowing to that area and could actually help with recovery. Many of us have read a lot of information about the benefits of ice baths, right? And what that does for muscle recovery. Same idea. So just things that we can add. So really important, above all, gain clearance from a doctor before beginning to work with someone with a client with a chronic condition, and get educated. If you have no idea what the symptoms are or what chronic conditions are or what I should be doing, get educated. Enroll in a chronic disease fitness course, an arthritis fitness course. It gives you this education that can help best serve this population. And please reach out to me if you have any questions or would like more information about getting more specific information, more specific courses, certifications regarding chronic disease or arthritis or orthopedic fitness. All of this matters, and it makes a difference, not just to you, but it makes a difference to your client. So with that said, my name is Christine Conti. You can always email me at info@conti, CONTI with any questions regarding this, debunking our exercise myths surrounding chronic conditions. So I hope you have some takeaways, and I hope you go out there and you best serve this population that needs you most. Have a wonderful day.